And hi, David. Good to see you again. How are you?
Doing great, Stan. Thank you for inviting me.
No, really great to have you on the show, and really great to see you. I think in general, you've been such a contributor to the Columbia Business School program, and obviously the digital health program at Columbia Business School, and to the HITLAB summits and symposia. Just to give people a kind of a 1 minute view of what you do, and then tell them where you are in the world. Let's start with that.
Okay, well, maybe I'll start with where I'm at. Part of my interest in continuing the support for you and Columbia is I moved to New York. I'm a New Yorker now, living in the Upper West Side, not too far from Columbia. So excited to be in the big city, the Big Apple. My name is David Rhew. I'm the Global Chief Medical Officer for Microsoft. I am a physician, a technologist, health services researcher. Have spent the past 25 years evaluating and deploying technologies to improve health outcomes. So we're talking access to care, quality of care, patient safety, ways that we can improve the experience for both patients and providers, and find ways to improve the overall efficiency. It's been a real pleasure to be the Global Chief Medical Officer at Microsoft. Have been involved in many activities, everything from helping to look at how digital health can be used to be applied within healthcare. And then more recently, within the pandemic, given the fact that I'm also an infectious disease doc, have served as our international coordinator for the pandemic response, working with organizations across the globe, including the World Health Organization, CDC, and states, as they've been looking to battle the pandemic. So excited to be here. Happy to share my thoughts on anything.
Yeah, well, Vive and HIMSS, certainly HIMSS, that's the topic of the symposium this week. And we've covered a lot of different things, from virtual first companies that are a big part of what Vive and HIMSS were talking about this year, and certainly inclusion and diversity, which was a big part of it, cloud services, and moving entire electronic health record systems to the cloud, which traditionally hospital systems have just bundled those up on their servers. And so, yeah, would love to hear more about your experience at HIMSS and talk a little bit about what you saw there.
Well, I'll start it first from a personal perspective. It was so great to see people again, to be at a conference where you had an opportunity to see old friends and colleagues and be able to interact in ways that you just sometimes miss in the virtual world. At HIMSS, Microsoft had a fairly large presence. We were there with our new acquisition, Nuance. I'd say there were many key themes that emerged from our discussions, given the fact that Nuance is one of the leaders, if not the leader, in voice technology for healthcare. AI was obviously a big part of what we talked about. We talked a lot about, and we saw many sessions that related to the use of voice, text, video, image, you name it, a whole series of ways to convert unstructured pieces of information to structured formats. That information ultimately has to be combined in ways that we can make sense of. So interoperability was also a big theme. I actually moderated a panel with Vicky Tripathi from the ONC and a variety of other folks talking about not only healthcare interoperability, but also the ability for consumers to be empowered with their own health records using interoperability standards such as Smart on Fire. And I think the real exciting part of HIMSS is always the companies and the people, and working with having the opportunity to work with our partners and clients, anywhere from very large organizations to very small startups. And it's always great to see the innovation that's coming out.
That's fantastic. And in terms of the some of the different elements of HIMSS, there were a lot of different things with startups, and certainly would love to hear a little bit about what you guys are doing with Nuance, which has always been my favorite voice to text translation engine. It's amazing. And the fact that Microsoft is so deep in hospitals, it makes a ton of sense to me. And I think a lot of people, obviously. So let's tell us about, let's start with, we have a lot of startups that are on the show today and that are certainly watching right now. Let's start with the startup and world and what Microsoft is doing to enable those folks.
Well, I can tell you, having been a principal at a startup myself, I know how difficult it is to kind of get to that next level. And oftentimes you have only just a few chances to make it right, because you'll run out of funding is the reality. And so, it's difficult to be able to carry a vision without that support. And I oftentimes find that the amount of time and resources that a startup spends to do, I'll call the basic blocking and tackling, things that are infrastructure, is extraordinary. And especially now that we think about how data needs to be secure and protected from cyber attacks, how we need to start focusing on building capabilities using APIs to connect data using FHIR. I mean, that's going to gobble up a lot of your time and resources. It's not something that I think it really creates a lot of value add. Where startups can leverage their capabilities is the innovation and building off of those capabilities. And so that's really what Microsoft is trying to do. We're trying to help support startups rather than trying to think about the basics. We want to provide the framework and then help build on that stack with a variety of different tools and capabilities, such as APIs for FHIR that span across multiple different modalities. I heard you were just talking about devices. Well, Internet of Medical Things or med tech devices, FHIR enabled, images, DICOM FHIR enabled, EHR claims data sets, all FHIR enabled. This is the type of platform or support that can be very helpful for startups. And what we've done at Microsoft is launched Microsoft for Startups. And specifically, as we talk to a lot of the healthcare startups, our hope is that they can build on the platforms that we already have in place and essentially become much more efficient and effective in their ability to capture the imagination and the attention of the folks that will help keep them running for years to come.
That makes a ton of sense. So, and building off of that, let's talk about Nuance. Obviously, that's a little bit more than a platform that can connect into Microsoft. That's now a part of the Microsoft platform itself. And talk a little bit about the acquisition, why it made sense, and then what some of the plans are to dial that up within Microsoft applications. And is there a plan, like, not that you can even comment on this, but we have to ask you, like with Oracle buying Cerner, now people are asking, well, look, Microsoft's a big tech company. Are they going to buy an EHR or something like that? Tell us a little bit about your plans with Nuance first, and then any kind of EHR integration issues or visions that you guys have as well.
Well, our partnership with Nuance has continued to grow throughout the years. And during the pandemic, we actually had been developing a technology that was very complementary with what Nuance had. The technology was something called ambient clinical intelligence. And originally, as we started developing and testing it, we realized a significant number of things that need to be put in place. One, you had to recognize who's speaking. Then you had to be able to convert that from voice to text and then map it on the back end to medical terminologies. And then here's where the AI came really helpful, is to understand what those terminologies were, to create concepts and be able to help organize that into clinical progress notes. Now, we were able to go pretty far with a lot of the work that we'd been doing. We certainly didn't even have a sort of like a capability to go to that next step of integrating into the clinical workflows and EHRs. And that's what Nuance had already had built in place. And so while we had a complementary set of tools and capabilities, it was a perfect match in terms of being able to deliver on the things that we have been focusing on, which is natural language processing and processing of a variety of other types of unstructured forms of data in an environment that allowed us to be able to do several things, have it workflow compatible. And because of the fact that Nuance has already established themselves as the leader in this space, we just thought it was a natural fit for us as we continue to help organizations address this by leveraging the fact that we've now got two organizations that complement each other very nicely. And so that's kind of how it started. And, clearly there's been so much interest in terms of the ambient clinical intelligence, given the fact that it reduces the amount of time it takes for clinicians to enter documentation into the EHR, anywhere between 50 to 80% of their time. I mean, that in itself is a huge, huge deal. But we're also recognizing that this could be a stepping stone for us to be able to do so much more, even beyond the physician-patient encounter. It could be other clinicians to patients. And then as we think about decision support, such as things related to identifying gaps in quality and safety and regulatory and and potentially even reimbursement. Huge opportunity for us to be able to leverage that.
That's great. There's some questions in the chat box as well about the Q&A about the ability for and some of the Microsoft tools that are out there to help safeguard aggregated records for patients. And again, maybe a minute or so about what tools there are today or what ones that are being planned.
Well, I'll start with first the basics in terms of the cloud infrastructure. Clearly, there is an ongoing need to continue to look at how we can protect and secure that data. And given the increasing number of cyber attacks that we are seeing and will continue to see, this has become something that is very difficult to manage. In fact, I was on a call earlier today with some folks from representing European countries, and during the call, there was a discussion around how the number of cyber attacks on healthcare have been increasing, and there's always concerns about this. And it turns out that a lot of the organizations that in the past had relied on on-prem solutions, they found themselves actually more susceptible, more vulnerable to the types of attacks because of the fact that there wasn't an ability to do real-time updates and be able to adjust very nimbly towards this. So I think what we're going to find is that cloud in itself will be a big component of how we understand our ability to secure and manage and protect that data. But then as it gets to the point of how we can make this something more useful for people, it then ties back to what we talked about earlier, the interoperability and making sure that as we get to the point of understanding what standards, and I think right now we're heavily leaning on FHIR as a key standard, this needs to be applied across the board.
Brilliant. And then the last quick question on Nuance for startups. Again, love the fact that Microsoft has Nuance in its family now. What kind of Nuance tools are there for startups?
Yes, and a Nuance as well. I mean, having been in the healthcare space for quite some time, has been partnering with many companies, of multiple different sizes. And so what we're going to probably want to do is we're going to need to compare notes, look at the companies that work with Nuance, the companies that work with Microsoft, historical Microsoft, and find ways that we can better support them through now the expanded number of assets that we have today. And I think that's going to be one of the real exciting things with this partnership. There's just so much synergy with the things that we're going to be able to provide. And a big part of our goal is to empower our partners and our clients with these tools. And so as we start figuring out ways that we can tightly integrate our capabilities with Nuances, it's only going to benefit our partners and our clients.
That's absolutely true. No doubt about it. Well, that is fantastic. And one last question. Are there any disease-specific initiatives that Microsoft is taking right now?
So there are many areas I'd say that we've been looking at. I'll highlight a few. When you look at how AI can be applied to different categories, certainly there's a lot that relate to very common diseases. We'll call it cardiovascular, cancer, a lot of the chronic diseases, even COVID. But then now as we start thinking about rare diseases, there's also an opportunity. We recently announced a partnership where there's an open source platform for organizations to be able to share their data in an anonymized way with de-identification, anonymization, so that we can enable more collaboration around areas that oftentimes don't get recognized because they're not the ones that everyone thinks of every day. But that's the opportunity with AI. We can focus on some of those things that get missed, as well as areas that we all know have a huge impact. And we're looking forward to trying to figure out ways that we can apply AI in ways that will allow us to learn more from the data and become much more proactive.
It's fantastic. Again, David, thank you very much for joining us today. An incredible amount of insight about not just what you were doing at HIMSS and what Microsoft is really doing at HIMSS, and but also what Microsoft is doing in digital health and in healthcare with the acquisition of Nuance. Thank you for joining us today.
That's my pleasure. Thanks, Dan.